Welcome to our second Facebook Live. My name's Ellen, this is Courtney.
Hello.
Good morning. Today we will be talking a little bit about iron deficiency and the different kinds of things around that. So it's something that we do treat quite often as naturopaths in the clinic. I'll just give you an overview if you're new to our Facebook Lives, or new to our clinic, about what we do as naturopaths. So we look at treating the whole person instead of just looking at numbers on a blood test, basically, but we do take that into account all the time as well. And we like to work alongside your doctor. We work alongside of other kinds of practitioners. We like to educate you about what we're actually treating you for and why we're giving you certain kinds of supplements or herbs or lifestyle recommendations or dietary advice and things like that. Is there anything else, Courtney?
Yeah, all your team, if you have a team already behind you, will be integrated and we work with that. And I guess the holistic approach is looking at the whole person, looking at the factors of diet, lifestyle and environment so that we can get your treatment right. And pathology, as Ellen just mentioned, numbers on the page are one element, and we always look at the pathology in conjunction with clinical presentation. How do you feel? And do those numbers match up to how you feel? And we work out a strategic plan to address those and correct imbalances and bring up deficiencies.
Cool. So with iron, we'll just start off explaining about what it does in the body first, and then we can kind of talk about where you get it from and what other kinds of things you can do to help it. So iron is one of the most important nutrients that works on carrying around oxygen around your body. So your iron is something that helps with lots of different things in the body, but signs and symptoms that you might be able to notice if you are iron deficient. So certain things that can cause iron deficiency as well that we'll go through, but certain symptoms that you may notice if you are iron deficient can be lots of different things. So the main thing that people might present with are fatigue. That would probably be number one, do you think? Yep. Other kinds of things can be having pale skin, pale under the eyelids. So if you go like this and you can see that it's not pink.
Yeah, this little bit here, this little lip that we can see ourselves, it's actually called the conjunctiva. And if it should be nice and red and plump, if it's actually pale, that's a really quick way to look at an iron sign. And another way we can be pale is what we call our palmar creases. So we have these lines on our hands that run on every single hand. And if you're into palmology or whatever that's called, there could be more significant things that we could know about. But essentially, if those creases are pale, they're called pale palmar creases. And that's actually a really quick way to do your own body assessment on what your iron levels might be like. And again, we wouldn't just take the paleness of your hands, we would look at and listen to other symptoms, maybe do an iron test, and we'll go through what we look at in terms of an iron pathology and what we might do to address that.
Other kinds of things that you might notice is dizziness or feeling fuzzy in the head as well. So sometimes people who lose their balance easily or notice that they're becoming more clumsy because of that slight dizziness, but might not realize that it's actual dizziness. Low body temperature is another thing. So people who get really cold hands and feet all the time because it's all about the microcirculation that's going on.
Carries the blood and oxygen around the body, so having cold extremities, there's not enough iron and therefore blood in the body to get to those extremities. So cold hands, cold feet and poor circulation and feeling the cold can all be signs of iron as well.
And your iron is also something that's really important for your immune system. So when people are getting sick all the time, picking up every little cold or flu that's going around school or the office or wherever it is, that can be a really good indicator that there may be some kind of issue with the iron happening in the body. Another thing that's interesting is actually about restless legs or leg cramping at nighttime can really be linked. And a lot of people think of that as magnesium, right? Doing magnesium spray or magnesium supplements, but a really big one is actually iron deficiency. So how do we actually get iron?
So generally speaking, because iron is such an important factor in the body, we always need to be looking at supporting that through ideally foods. Every single nutrient in our body, we should be getting the right levels through a diet. And the only way we can get levels like iron through diet is by having a good digestive system. We may have heard of the term we are what we eat. Us naturopaths here actually feel a little bit more passionate about we are what we absorb, and the absorption comes through a good digestive system. So one way to look at whether you're getting enough iron is absolutely, am I eating iron-rich foods? So firstly, iron-rich foods we know is red meat, fantastic. What if I'm vegan? What if I prefer plant-based foods? Your green leafy vegetables, and yes, Popeye was a thing, so eating your spinach really can work to boost iron levels. Chickpeas is another great one. Lots of nuts and seeds have minerals like iron. And I guess the important thing to know about the red meat iron versus your plant-based irons is that it just has a technicality of what we call heme versus non-heme. And in a general sense of trying to work out what is the heme and non-heme differences are, the body absorbs heme iron from red meat really well. It's actually really quite dense as well, the amount of iron in red meat. It's not to say there's not good amounts of non-heme iron in plant vegetables and green leafies. It's that the quantity may not be there in terms of how much spinach you might need to eat versus how much red meat, but it's also how the body absorbs it and how the body can be enhanced in its absorption of both heme and non-heme sources of iron, so meat and vegetable and plant-based sources of iron, is vitamin C. So vitamin C, eaten or drank at the time that you're eating iron-rich foods, can be a great way to boost up your absorption of that mineral to help the body grow and flourish. So we would recommend something like a squeeze of lemon or lime juice in your water when you're having iron-rich foods. Any other suggestions you can think of for vitamin C boost?
So vitamin C is really high in kiwi fruit.
Kiwi fruit.
Which is a good one, which also has good digestive enzymes. So with that, with things like vitamin C, we call them iron's little friends. So that's a good way to think about it. It kind of buddies up and helps it to get absorbed really well into the body. And another one is your B vitamins. So specifically things like your B6 and B12. So the B12 is very linked in with those similar kinds of symptoms that go along with iron deficiency as well. So sometimes it could be both deficient, sometimes it could be one or the other, but really it's important to focus on both of them at the same time, and where you're actually getting it from your foods. Other kinds of things, you can get slight amounts of iron from different kinds of mushrooms, looking at shiitake mushrooms as well, but like Courtney said, it's looking at that heme and non-heme form of iron that's really important. Anything else to add for that, Courtney?
Yeah, so coming back to the friends of iron, we as naturopaths, when we look at pathology, we might have to take into consideration the levels of those B vitamins, B12 as well, folate. They may be the reason the iron isn't behaving well or the levels aren't adequate, and those types of deficiencies of other nutrients can change the actual pathology of why the iron is low and what's happening with the size and shape of the red blood cell as well. So we, again, as we're always doing, we're looking at the whole picture. We're not just taking your tide sign and it must be iron and shooting off with iron for the rest of the month. Iron, particularly as a mineral, we don't really have many in the body that, if prescribed unnecessarily, can be toxic. And the last thing we want to do is give you anything that's not desirable or not in fact necessary. So naturopaths are very passionate about getting that iron checked, looking very closely at the levels and prescribing accordingly and very specifically. One person's iron deficiency may absolutely need B12 in conjunction versus another one who just needs a simple iron boost. Should we talk a little about pathology now?
Yeah. So with pathology testing for iron, it's also really important, just before we go into that, about people who don't get their iron checked but are having symptoms similar to deficiency in iron is that you can actually be too high in iron, and that's something that's called hemochromatosis, and it's a genetic kind of condition, so you can get the testing done for that as well, but that's why it's just so important to get the testing before you supplement, because it can be toxic. But we generally recommend to get blood pathology done for iron deficiency rather than just focusing on symptoms and looking at your eyelids. It can be a good sign, but to be able to actually know what's going on underneath is really important to get that done. So with understanding what's happening with your iron blood tests, if you've had your iron checked before, you might see that there's quite a few different kind of markers that you can see on the iron testing. So a really good analogy that I like to use to understand and to teach patients about what the iron means is with your, so we'll just talk about the two most important ones, which is your serum iron and your ferritin. So your serum iron, if we can relate it back to thinking about money, change in your pocket, money in the bank. So your serum iron is the change in your pocket that you use every day. So that's for day-to-day kind of things that your body needs to be using the iron for. And then your ferritin is to do with the money in the bank. So it's kind of like your stores, your savings that you use when something big needs to happen. So immune function is a really big one. Sometimes we see that the iron stores can be very, very low, and then the serum iron can be fine. So that's why not just checking the serum iron, always checking the ferritin is really important, and vice versa. Does that make sense?
Yeah, absolutely. And I think it's important to look at what takes away our iron, like Ellen said, the big things. So women's monthly cycles, which is why women are more prone to iron deficiency, because we lose iron through blood on a regular basis. And I think taking into conjunction the information in an iron study. So we're really passionate about reading all the information that we have, which includes what we call a reference range. And a reference range of something like ferritin can range somewhere in the realms of about 30 as a minimum, up to about 290 or 300 as a maximum. So if we're looking at baseline, absolute medium, run-of-the-mill storage facility of that iron that you need to draw upon when the body requires it, if we're not even reaching midline or middle of the way through, that can actually present like an iron deficiency. Even though the test may read okay and normal, again, we look at that patient in front of us, we go through the checklist of iron symptoms, iron deficiency symptoms, we look at the pathology reading, and we go, right, we really do have room to build up the capacity for the body to store that iron as and when needed, when we get a big immune hit, when we're stressed, because stress eats all our nutrients. So these are the kinds of things we love explaining to our patients on that one-on-one consultation basis, because they've had 100 iron tests before, no one's ever bothered to explain it to them. And what they can do then is have a really good understanding of it moving forward and be able to be in control of their own iron levels in the future and know how they feel and what does my pathology say. So that's the kind of thing we love to do.
Yeah, cool. And also looking at things that can bind to iron as well. So sometimes people take their iron supplement in the morning with their brekkie and their cup of tea or their cup of coffee, and that is something that actually binds to iron. So tannins, which is a group of, it's in a lot of different kinds of foods and drinks, but that's something that can bind to iron. It kind of like eats it up, takes it away, doesn't give it to anything in the body. So when we are supplementing with iron, it's important to try and remove those kinds of things that could be reducing the absorption of the iron, and then trying to have some of those things that Courtney said before that will increase the absorption of the iron, like the vitamin C and the B vitamins, which is really important.
Absolutely. And competing minerals as well. So we might not be aware if we're self-prescribing through the pharmacies and the supermarkets, which can be great to a degree. We need to separate minerals like zinc from iron. They will compete for absorption. You may not absorb either or only one. So generally, because iron is for energy and circulation is very uplifting, we like to prescribe iron in the morning. If you're needing to take zinc for any reason, it's supportive in a more inhibitory, calming kind of way, so we prescribe it at night. well away from iron, getting the best of the both nutrients if you are in fact deficient in those.
So it's kind of like the iron and the zinc have similar little binding sites. So it's like a little puzzle piece. When they want to go into the body, they need to lock into that little, say, triangle shape. But if something's already there, say like the zinc, then that iron isn't going to have anywhere to go, which is really important. When if you're supplementing with iron, you want to be making the most of your supplements, not just having them float through and float out.
That's right. Or if you've been taking an iron supplement for a few months and you don't feel any different, is it because you were taking it alongside something that was competing for absorption? Is it because you were drinking or eating something that was inhibiting that absorption as well? Is it because you didn't need iron and you thought it might have been iron and it's not actually the mineral for you? So these are the kinds of things we love working out with our patients so that you can feel better much quicker.
And kind of just overview of all of this is that looking at iron deficiency, you don't just become iron deficient for no reason. It's not something that just happens in the body. You can be predisposed to these things in terms of if different members in your family might be predisposed to these things, but there's something that has to be triggering it. So whether it is looking at digestive function with that absorption, looking at the hormones with what's happening with bleeding monthly for females, and looking at immune system, whether you need that extra support of the iron and that's why it's being depleted. So there's generally always some kind of reason as to why this is happening. So instead of just taking the iron supplement, looking at what's actually happening underneath, why it's not being absorbed, why it's happening in the first place is the most important thing.
Absolutely.
Yeah.
That cause.
Yeah. So if you are interested in knowing more about iron deficiency, about gut, about hormones, all of these things, you're welcome to pop into the clinic or attend one of our workshops that we run on the coast. So we are running workshops around the coast and in Brisbane and on the Gold Coast shortly in July. So if you're interested, pop over to our Facebook page and have a look there. But we'll be back next week.
Yeah, great. Thanks for joining us.
Thanks
We'll see
so
you soon.
much. Bye.
Bye.